I have been a therapist for over 10 years. I specialize in orthopedic physical therapy, and I don't specialize in, but I treat vertigo therapy patients, which is more the dizziness, which a lot of people don't realize that they can get treated for that. There's sometimes a dizziness that doesn't really work, but there's a lot that can be treated. We do gait and balance treatment, pre-op, post-op, general aches and pains, pretty much everything. And I have treated from 5-year-olds to 97-year-olds, so no one is off limits. We do sports, but we also do chronic pain, so there's a little bit of everything. I treat Parkinson's patients, patients with MS, a little bit of everything, and I love the older clientele because they've got a lot of stories left to tell, and it's just, in my opinion, therapy gives you a chance to connect with people, and I've kind of slowed it down to where instead of seeing multiple patients an hour, you get to be one-on-one or 1-2. So you see your therapist. It's not just, hey, how's it going, for 8 minutes, and then out the door there they go, or you wait 3 hours to see your doctor and then you get to visit for 2 minutes, right? It's very much, hey, how's it going? How's your daughter-in-law? Whoever else, we get to know our patients, which I really value, because I think aside from seeing God's beautiful green earth, it's about human connection. So we do that as well as care for the patient. And the name Olive came from, I'm a huge dork and I like puns. And so it's Olive Physical Therapy for all of your therapy needs. Sometimes you can't fix it, but what you can do is educate them, teach them ways to manage it, make it less painful, make it where they can figure out something that they can do functionally that they still enjoy, so that you improve quality of life. It may not extend quantity, but the quality gets better. It's very similar to, again, Parkinson's patients. They're not going to improve, but you can still do things to give them better quality while they're around. The biggest thing we see is gait and balance issues that stem from, I have arthritis in my knee, or I have a bad back, or something like that, or I fell and I hurt my shoulder. There's a lot of that intertwines into, this is how I hurt myself. And maybe they're okay now, or they're muddling through and it's okay for right now, but at some point it might jump up and bite them. And a lot of people don't want to say, oh, I have a problem walking, because it makes them feel old. And so, and I get that. And I was like, unfortunately, it's just something that happens. I want to get back to that basics. What do you actually need? Not just what does the corporate metric tell you have to see a patient for. So I get a lot of people that come in, they're like, I can't do this. I can't afford that. I can't. It's fine. My goal is to make you proficient. And if you need me, you have me as a tool. And if I need to do something with you weekly, cool, we can do that. But how long does that need to last? Because there's a lot of places that are like, come your 12 visits, or you can buy sessions of 18 or whatever. It's not how it works here. It's what do you actually need? We take all sorts of insurance, a lot of the main commercial insurances, and then we take Medicare, Medicaid, different advantage plans of Medicare. We take those as well, and we also have cash pay available. So if you don't have insurance and you're like, I don't want an insurance plan, awesome, we got you covered. We'll take your money however you want to give it to us. Contacting your doctor, getting a referral is the best way to come in and see us. But you can start therapy, then ask your doctor, hey, can I get a referral, and have them send one over. And by all means, I'm happy to talk to whoever I need to explain what we're doing and why we're doing it, and send over any information.